Mr. Halloran, welcome to the Rules Committee. We're delighted that you're here also. Gentleman's recognized.
Thank you, Mr. Chairman. I'm here to offer the O'Halloran Amendment to SCON Res 3. I come before the committee today to support my common sense amendment that affirms our commitment to our promises to our seniors. My amendment simply ensures that any legislation under this budget would not increase premiums or out-of-pocket costs for seniors for prescription drugs in Medicare Part D. While the Affordable Care Act is not perfect, one of its most popular provisions, closing the donut hole in Medicare, has saved seniors money and encouraged drug adherence, lowering costs to the taxpayer. As you know, seniors often live on limited fixed incomes. Half of all beneficiaries who rely on Medicare live on less than $24,000 a year. And it's even lower in certain communities. Latino seniors with Medicare live on less than $13,000 per year. My district is diverse, but what I hear over and over again across the community and across Arizona from seniors is how hard it is to stretch a dollar on a fixed income to cover the cost of prescriptions, housing, food, and medical care. Closing the donut hole has made important progress on the bottom line of seniors with Medicare Part D coverage. Seniors across Arizona have saved over $362 million since 2010, with beneficiaries saving an average of $966 each on their prescription drugs. $966 per beneficiary in Arizona. That is real, hard-earned money that provides enormous relief to families. And nationwide, nearly 10.7 million Medicare beneficiaries have received discounts over $20.8 billion on prescription drugs, an average of $1,945 per beneficiary. Before closing the donut hole, beneficiaries had to pay the full cost of their prescriptions out of pocket before catastrophic coverage took effect. We all know what happened when seniors went to the drugstore to fill their prescriptions and found out they had entered the coverage gap. They simply chose not to fill the prescription. Or they split pills, or they made difficult household decisions like foregoing groceries and other necessities so they could get their medications. That system was bad for seniors and bad for our healthcare system. When people don't fill their prescriptions, they're more likely to need more expensive institutional care down the road. Closing the donut hole was a critical investment in our bottom line for our seniors' health. My amendment prevents reopening the donut hole and thus affirms our commitment to lowering overall costs and ensuring the continued success of Medicare Part D. Arizonans and Americans overwhelmingly want Congress to take action to lower prescription drug prices, not raise them. Any legislation that increases premiums or out-of-pocket costs for seniors in Part D is the wrong approach. Seniors in our communities are watching. They are counting on us to do right by them and uphold our promise to protecting Medicare. I urge the committee to make in order my amendment in support of seniors in successful Medicare prescription drug program. And I look forward to your questions. And on another note, I'm on Medicare, and I know what the donut hole means to me when it comes around. And I also knew what it meant to my mother when she was 86 years old. And recently to an uncle of mine, a war veteran, who was 96 years old when he died. And the commitment I made while I was running for office is that we would protect our senior citizens. I've paid into the program now for well over 50 years of my working life. And I think that's a commitment that the government has made to myself and the other seniors in this country that we should adhere to. Thank you.